New at 11, imagine going to your doctor for treatment, having him or her prescribe what they say is the most effective medication, but then being told you can't have it. That's what some say is happening with the growing trend that's known as step therapy. Critics say that insurance providers are forcing patients to fail first by making them take less expensive medications generally. Well, tonight I get the bottom line on the practice and how its cost is affecting more than just your wallet.
This is 2 pills twice a day.
Scott Daly of Rotterdam shows me his buffet of prescription drugs.
This is once in the morning.
He takes this regular regimen after contracting HIV in 1986.
I had gotten HIV from a fiance who got it from a blood transfusion, and she passed away in 1989.
On top of his HIV treatment, he takes other meds for side effects, one of them being high cholesterol. It took him and his doctor 7 years to figure out which script was the most effective, Crestor. Until one day, a big surprise when he picked it up at the pharmacy, a change in the medication.
I asked the pharmacist about it, and he said this was a generic.
A generic script, not changed by his doctor, but by his insurance provider. It's a practice that's grown to be known as step therapy.
This happens every day. At least once.
Dr. Charles Argoff specializes in pain management at Albany Med.
Step therapy is exactly as it might sound. It's being required by, let's say, for example, an insurance company who pays for care for that person to go through steps that might be failures.
So if I'm dealing with migraines, my doctor might tell me the most effective course of treatment is to take Relpax. It's a brand name, likely more expensive, but my insurance company might say, no, you have to take a generic first. If that doesn't work, another generic and possibly another, essentially making me fail first before being allowed to take what my doctor recommended.
In his line of care, Dr. Argoff says he sees it all the time.
Nerve pain due to diabetes, nerve pain due to chemotherapy, chronic low back pain.
Other common issues affected: Lyme disease, multiple sclerosis, epilepsy, even mental health. They're not better therapies, says Argoff. They're generally less expensive. But because they're also less effective, those costs can add up over time.
For a switch in medication, you have to now go in and pay either a $10 copay or a $20 copay.
For Scott, between changing meds and changing dosages, it added up to an extra $60 in a year. He and his doctor finally convinced his insurance company to allow him to change back to Crestor. But he and Dr. Argoff say the physical cost of step therapy is a much steeper one.
Like a carrot on a stick, it's being held up and said, you can't have this until you fail these other things. We have to be able to have a dialogue in such a way that we stop this nonsense.
Now, to try to curb step therapy, state lawmakers introduced legislation this past session that would give doctors a clear process to appeal the protocols and limit the amount of time that a patient could be forced possibly to try another medication. That bill got stuck in committee, but I am told that it will be reintroduced again next year. Of course, I'll be staying on this to get the bottom line.